Hey everyone, ওয়েস্ট বেঙ্গল হেলথ রিকোয়ারমেন্ট বোর্ড একটি নতুন আপডেট নিয়ে চলে এসেছে। তো এইবার থেকে সিবিটি এক্সাম কন্ডাক্ট করা হবে। সাইডে আমি এর নোটিশটি আপনাদেরকে প্রোভাইড করে দিয়েছি, আপনারা ভালো মতো দেখে নেবেন। কোশ্চেন নাম্বার 1, which vitamin is essential for blood clotting? Here correct option is option D, vitamin K. Question number 2, the normal range of hemoglobin in. Here correct option is option B, 12 to 16 gram per deciliter. Question number 3, what is the primary function of red blood cell? Here correct option is option B, carry oxygen. Question number 4, which type of insulin has the fastest onset of action? Here correct option is option A, regular insulin. Question number 5, what is the normal respiratory rate in adults? Here correct option is option B, 12 to 20 breath per minute. Question number 6, which electrolyte imbalance causes tetany? Here correct option is option B, hypocalcemia. Question number 6, which pulse site is most commonly used to check an unconscious patient pulse? Here correct option is option C, carotid pulse. Question number 8, which condition is characterized by an abnormal increase in white blood cell? Here correct option is option B, leukocytosis. Question number 9, what is the normal pH range of blood? Here correct option is option C, 7.35 to 7.45. Question number 10, which is the most common site for intramuscular injection in adults? Here correct option is option C, ventrogluteal muscle. Ventrogluteal muscle is common site for injection, or deltoid muscle ও দেওয়া যায়, কিন্তু common site is ventrogluteal muscles. Question number 11, which type of precaution is required for a patient with tuberculosis? Here correct option is option C, airborne. Question number 12, which is the first line treatment for anaphylaxis? Here correct option is option C, epinephrine. Question number 13, which cranial nerve is responsible for vision? Here correct option is option B, optic. Question number 14, which organ produces insulin? Here correct option is option B, pancreas. Question number 15, which electrolyte is most abundant in the extracellular fluid? Here correct option is option A, sodium. Question number 16, which condition result from a deficiency of ADH, that means antidiuretic hormone? Here correct option is option B, diabetes insipidus. Question number 17, which position is best for a patient experiencing shock? Here correct option is option B, Trendelenburg position. Question number 18, which hormone regulates calcium level in the blood? Here correct option is option B, parathyroid hormone. Question number 19, what is the primary function of platelets? Here correct option is option number C, blood clotting. Question number 20, which part of the brain control respiration? Here correct option is option B, medulla oblongata. Question number 21, which artery is commonly used to measure blood pressure? Here correct option is option B, brachial artery. Question number 22, which of the following is a common symptom of hypoglycemia? Here correct option is option B, shakiness. Question number 23. Which organ is primarily responsible for detoxification in the body? Here, correct option is option A, liver. Question number 24. What is the normal heart rate range for an adult? Here, correct option is option B, 60 to 100 beats per minute. Question number 25. Which infection is commonly associated with prolonged use of antibiotics? Here, correct option is option B, Clostridium difficile. Question number 26. Which organ store and concentrate bile? Here, correct option is option B, gallbladder. Question number 27. What is the primary mode of transmission for hepatitis B? Here, correct option is option C, blood-borne. Question number 28. Which blood vessel carries oxygenated blood from the lungs to the heart? Here, correct option is option A, pulmonary vein. Question number 29. Which term refers to difficulty in swallowing? Here, correct option is option B, dysphagia. Question number 30. Which condition is commonly associated with night sweat, weight loss and persistent cough? Here, correct option is option A, tuberculosis. Question number 31. Which of the following is a late sign of hypoxia? Here, correct option is option B, cyanosis. Question number 32. What is the antidote for opioid overdose? Here, correct option is option A, naloxone. Question number 33. Which part of the heart receives deoxygenated blood from the body? Here, right option is option C, right atrium. Question number 34. Which condition is caused by deficiency of vitamin B12? Here, correct option is option B, Pernicious anemia. Question number 35. What is the most common site for checking an infant's pulse? Here, correct option is option B, brachial artery. Question number 36. Which part of the brain is responsible for maintaining balance and coordination? Here, correct option is option B, cerebellum. Question number 37. Which of the following is a sign of increased intracranial pressure? Here, correct option is all of above. That means bradycardia, hypertension and irregular respiration. Question number 38. Which of the following is an isotonic IV fluid? Here, correct option is option B, 0.9% of NaCl. Question number 39. Which vitamin help in calcium absorption? Here, correct option is option B, vitamin D. Question number 40. Which type of a fracture is most common in children? Here, correct option is option A, green stick fracture. Question number 41. Which condition is associated with increased uric acid levels? Here, correct option is option B, gout. Question number 42. Which of the following best describe third degree burns? Here, correct option is option C, damage to all skin layers. Question number 43. Which electrolyte is primarily responsible for maintaining fluid balance in the body? Here, correct option is option B, sodium. Question number 44. What is the primary function of the spleen? Here, correct option is option B, blood filtration. Question number 45. Which of the following medication is a loop diuretic? Here, correct option is Option A, furosemide. Question number 46. Which of the following is a common cause of pulmonary embolism? Here, correct option is option A, deep vein thrombosis. Question number 47. Which part of the nephron is responsible for filtering blood? Here, correct option is option B, glomerulus. Question number 48. Which condition is associated with excessive ADH secretion? Here, correct option is option B, SIADH. That means syndrome of inappropriate ADH. Question number 49. Which medication is used to treat bradycardia? Here, correct option is option A, atropine. Question number 50. Which of the following is the best position for a patient in respiratory distress? Here, correct option is option B, high followers position. Hey everyone, welcome my YouTube channel. তো এবার থেকে সিবিটি এক্সাম কন্ডাক্ট করে দেওয়া হলো। এখন আমাদেরকে এমসিকিউ খুব বেশি করে প্র্যাকটিস করতে হবে যাতে আমাদের পরীক্ষাটা ভালো হয়। অ্যান্ড যারা এর আগে সিবিটি পরীক্ষা দাওনি তারা অন্তত একবার প্র্যাকটিস করে যাও। অল দ্য বেস্ট। অ্যান্ড সিবিটি এক্সামের জন্য কী কী সিলেবাস আসবে আমি আপনাদেরকে ফার্দার ভিডিওতে ডিটেলসে বলে দেবো। তবে সিএচও পরীক্ষাতে যেসব সিলেবাস দেওয়া হয়েছে এর আগে সেসব আমরা পড়ে পরীক্ষাটা ইজিলি মানে ক্র্যাক করতে পারি। ওকে গাইজ, বাই বাই। দেন নেক্সট ভিডিওতে আমরা দেখা করছি।